There are up to anywhere between 30 and 50,000 immigrants detained on any given day in the United States, and this includes approximately 7,000 children. It's really important to remember that these individuals are not serving time for a crime or criminal statute. Instead, they're waiting for hearing to determine whether or not they can legally remain in the United States under a civil proceeding. Immigration law is largely a civil administrative law. During the first week of March 2020, just before social distancing and shelter-in-place policies went into effect in Illinois, I had the distinct pleasure of accompanying 8 Loyola law students and 2 other faculty supervisors to conduct a service project immersion trip at the southern border in Arizona. We partnered with the Florence Project for Immigrant and Refugee Rights, and we assisted the Florence Project with their asylum cases and also providing Know Your Rights presentations to detained immigrants. All of the clients that we met with that first week in March were detained. Arizona is one of the states with the highest number of detained individuals, over 7,000 immigrants, and not just from Arizona, but from all across the country. When we went, just to give you a picture of what it looks like, we entered what are prison-like facilities. Again, even though this is largely a civil administrative hearing, these are prison-like facilities, and of the facilities that we went to in Eloy, each housed over 1,000 adult detainees. Before you even walk into the building, you're surrounded by endless rows of razor wire, and you'll continue seeing razor wire throughout the compound surrounding every single building at both facilities. There are armed guards in every room that have to escort not just the detainees, but also anyone visiting, including ourselves, from room to room. Now, in thinking again about the impact of COVID-19, when we were there, we observed no opportunities for social distancing. So detainees share cells. They are not allowed to move through the facilities without a guarded escort, as I mentioned. They eat in communal spaces, and they also shower in communal spaces. These are facilities that are designed to hold as many people as possible. And again, I'll just emphasize, we did not observe any opportunities for social distancing. And just days after we returned from this trip, many states, including Illinois, began implementing social distancing and also subsequently shelter-in-place policies. At the same time, many justice systems continued and also began and continued to shift their resources to essential services. What this means is police and prosecutors began focusing on violent crimes, detainees were being released, and criminal courts began prioritizing the most serious criminal offenses. Now back to immigration. So unfortunately for immigrants who are detained, it is business as usual. There have been no measures to limit immigration detention or deportation of immigrants, nor have there been any systemic changes in how detained immigrants and staff can better protect themselves in the face of COVID-19. At this point, there are over 45 lawsuits filed against the Department of Homeland Security across the country seeking release of adults and families on due process and statutory grounds. Many of these suits allege that gloves, hand sanitizer, masks, and other essential supplies are not available inside detention facilities. There are only a handful of cases where individuals have been released based on what's called a habeas petition, where lawyers are asking for their immunocompromised clients to be released out of immigration detention. Again, these are just a handful of individual cases. Generally, what we're seeing is there is an acknowledgement in response to COVID-19 of a risk of congregate care and congregate living as a huge factor in the spread of COVID-19. And while the government is encouraging social distancing, it has not reconciled this policy within the immigration system, and particularly in immigration courts or detention facilities. And while measures have been made for social distancing and increased access to protective equipment and practices in a variety of systems, this is not happening in the immigration system. And I would also just like to share that even before COVID-19, there were several nonpartisan groups reporting on the lack of access to proper medical equipment, proper medical treatment and care within these facilities. In fact, there was one government attorney who was recorded on video who was arguing that children Minors in federal custody do not need soap, and that soap is not an essential service. Many detainees are still complaining that they do not have enough soap, as well as access to other equipment such as masks and cleaning supplies to protect themselves from the virus. Given that the immigration apprehension, detention, and deportation system is continuing with no changes, full steam ahead, it is fair to say that this will increase the risk of transmission of COVID-19. And this will have potentially deadly consequences not for detained immigrants, but also for immigration court personnel, ICE officers, detention staff, and the general public and communities where these detention facilities are. Regardless on one's views on immigration, I believe we should all have a shared goal of saving lives, and this lack of any shift in policy regarding detention of immigrants is truly a tragedy, and I hope that at some point in the future we can update you with more positive changes.